Assalamualaikum, very good morning. We're going to continue for couple therapy. Uh, After we just finished a group psychotherapy, basically we use a little bit of Yalom's principle, and we talk about advantages, disadvantages, indication and contraindication to use in group psychotherapy. Basically, the same principle for group psychotherapy should also be applicable to a couple therapy. That's why we put couple therapy under group psychotherapy. The same thing too, like group psychotherapy, we wonder what sort of approach we're going to use, whether we're going to use psychodynamic, whether we're going to use a behavioral therapy approach or technique or cognitive therapy. The same thing also we're going to do for couple therapy. Whatever approach you use, just like group psychotherapy, you have to really emphasize on relationship. Okay, so basically, couple therapy is a type of psychotherapy in which therapists with clinical experience we attend couple problems. Normally, a group psychotherapy is handled or conducted by a licensed marriage and family therapist in the United States. But in our country, in Malaysia, even clinical psychologists, even counselors, licensed counselors can do that. We tend to help two people in a romantic relationship, to gain some kind of insight in their relationship, and we help them to resolve any conflict, crisis, and improve relationship to the extent that they understand each other and they can function as a normal couple. Okay. All right. So there are a few elements of couple therapy which is a bit more unique than group therapy. In group in couple therapy, we focus on a very specific problems. When a couple come to see me, for example, they can present so many cases, so many issues, and but you have to focus. You have to be specified. For example, they have issues related to sexual difficulties. A husband, for example, to have impotence problem, and internet addiction issues. Men always have problems related to playing games, for example, issues related to jealousy. And I had a couple who specifically come and see me to speak about uh, the wife who has been experienced anxiety problems. Then we really, in other words, you really have to specify the problems. And the active participations between the two couple, husband and wife, and boyfriend or girlfriend, for example, have to be active participations. We can't do a couple therapy if only a wife who doing the talking. Yeah, both of them has to contribute and actively participate in the group therapy. And we use a solution focused. At the end of each session, we wrapping up the issue. If we and we try to find solutions or agreement between couple on certain issues, for during sessions. And also, early in couple therapy, we have to inform the couple the focus or the objective of couple therapy itself. The objective has to be clear. And couple therapy should consist some principle to highlight the effectiveness of couple therapy. The first one is change the view of the relationship. Normally, a couple have a crisis when they have different views of on relationship. So throughout the therapeutic process, we put together the differences, and we try to change the perspective of each one of them to be similar in terms of seeing where is the sense of directions of the relationship itself. The second one, uh, normally couple will be in crisis as a result of dysfunctional behavior. What is dysfunctional behavior? A behavior that cannot be tolerated by spouse. And normally it's just like individual problems. This sort of behavior can interrupt and can cause dysfunction in a relationship. What is it? For example, a poor hygiene. One of the couple have a poor hygiene, and one of them, not one of the couple, one of them have poor hygiene. The second one, issues related to finance. For example, a wife who use credit card recklessly. So those we want in couple therapy, behavior that dysfunctioning should be changed into more healthier behavior. The third one is a very typical issues related couple conflict when one of them or both of them avoid uh, uh, sharing their emotional experience. But in couple therapy, they should not avoid those feelings, those emotions, and they have to uh, uh, increase the sharing feelings, or emotion, and they can start to feel more comfortable in terms of sharing their uh, private emotion and feelings about what's going on in their relationship with each other. Okay. And the other effective principle of conducting couple therapy is that couple therapies should improve three types of communications. You know, it is so common that a couple has a conflicting relationship or have a relationship in crisis when they do not have good communication. That is typically number one causes of why couple have crisis. We should improve their communications, and so they have to practice those three types of intimacy communication. Number one is closeness, is the ability to let down the inner barrier. You remove your inner barrier from communicating what you want to communicate with your spouse. For example, if you feel so shy about asking, your husband the use of his money, for throughout many years of marriage, for example, you never know how did he spend his money, and after 3 years of keeping that, you don't know, it bothers some, and it becomes a conflict among between couples. So you have to remove that barrier. You should be able to be more comfortable to ask, hey honey, so what's up with your salary, and how you use your finance, for example. Remove that barrier. And the second one is communication. Intimate communication has to be in which you are able to express freely, and you have to develop the ability to understand someone's feeling, especially your spouse. And finally, commitment, meaning that you agree to remain attached to your partner throughout thick and thin moment. Those are the three elements of effective communication. And number five, couple therapy should promote strength. You know, is strength promoting strength in the aspect of relationship and build resiliency between the two person who are in a relationship, because you know sometimes you when you function as a two person in a relationship, it's easily you lose focus on what the needs of the other partner. So couple therapy, we promote that kind of strength. So we educate our patients how to enjoy relationship with each other. And so couple therapy should be practiced just like the principle of group psychotherapy as well. So these are your reference. Most of our notes are from this reference. Andrew has been producing so many textbook, and this is one of them. Okay.